opportunity to celebrate with friends and families. Our healthcare workers have been heroes throughout the course of this pandemic, and they continue to be our heroes today. Where we sit on November 23rd is that we had 1,576 people hospitalized with COVID in the state of Colorado. We're not at that peak of 1,847 that we reached last December. We are still seeing an incredibly high rate of COVID hospitalizations. And the numbers that we see in cases and percent positivity are hopeful and indicate that maybe we are at the beginning of some type of plateau. Our hospitalizations are still high and they are staying high. And what you'll see on the next slide is looking here at the comparison of our hospitalized COVID patients to the availability of hospital beds. And as we have referenced many times in these media availabilities in the last few weeks, again, I call out on December 1st of 2020, we had 1,847 people hospitalized with COVID. We had an additional 1,800 hospital beds available. Today, we have 1,576 people hospitalized with COVID and only have 645 beds available. This is from a combination of factors. We know that there are staffing shortages. We know that there has been a significant impact of delayed care and people who are now requiring hospitalization because they did delay care. And so as we move into this holiday weekend, knowing that our hospitals are still in a very dangerous situation with a small amount of beds left, really do want to make sure that people are safe and careful this weekend. And while it is a wonderful opportunity to celebrate in a way that we didn't get to celebrate last year, it is incredibly important that we take care of ourselves and our families over this holiday weekend. And with that, I'll turn it over to Dr. Franz.
Thank you, Scott. Well, it's exciting to see that there is a hint of a plateau in cases from the last few weeks. However, we have holiday season upon us, and that just puts us at risk for cases to bump up again. So at the state, we're doing many things, as you know, to try and control our transmissions and reduce hospitalizations. And one area of focus has been on encouraging people to get their boosters. Since I think the 5th of November, almost 3 weeks now, we've been asking people to go and get booster shots. And I'm pleased to say that over 930,000 Coloradans have completed boosters. It's about 35% of all eligible adults 18 and over. And I think we are a leader across all states in the number of booster completions. So why is it important that we all get our boosters as soon as we can? There's really two broad reasons. First, we know that by getting a booster, you will reduce hospitalization rates for people 70 and older in particular, and really people 60 and older. It's clear that the vaccines wane with immunity over time after 5-6 months. And that waning immunity puts our older persons in Colorado at risk for hospitalization, and boosters is very important. I believe we're over 55% now of our residents in long-term care facilities that have been boosted, and we're going to keep working hard to get that number to 90%. So preventing hospitalization through booster, particularly for people of older age, is key. The second area of focus is in potentially reducing our transmission rates. And in our work at the state, we looked to the published literature on boosters and of course found that one of the earliest publishing areas was that Israel, and that we have here a couple of slides. I'll just point out to you their findings. First, that when they started to vaccinate the 60 and older with their boosters, they found a return to the levels of prevention of disease for hospitalizations and severe deaths, as was seen early with vaccination, over 90% protection against hospitalization. Next slide, please. The other thing they saw in Israel, which I found very compelling, was that as you vaccinate a cohort by an age group, within 7 to 10 days, the transmission starts to fall off among that age group. And so in this graphic, you see the rise in cases that began in Israel towards July, and the decision to vaccinate by age cohort that is here represented by these dotted vertical lines led to a following decline in transmission and cases. So to the left, you see a purple dotted line, which represents people over 60 who were vaccinated at the end of July. And 10 days later, if you follow the purple line of cases, you find that they started to decline for people over 60, while for everybody else, the cases went up. And then by the 10th, 11th of August, they started vaccinating the people who were 50 and older. And sure enough, 7 to 10 days later, cases started to decline for that age group, and so on for the 40 to 49-year-olds and 30 to 39-year-olds. And so this was compelling evidence that by vaccinating with the booster, not only do you protect hospitalization, but you actually reduce transmissions. And as we see cases and transmissions here in Colorado continue, and we all have friends who are telling us post-vaccination that they now are sick with COVID, we run the risk of continuing to spread that COVID, in particular, spreading it to people who are unvaccinated and who may ultimately end up hospitalized. So we have to do everything we can to make boosters available and encourage people to get their boosters as soon as possible. Next slide, please. I think I've heard, and you may as well, that it's been a challenge because of the demand for boosters to find an appointment for a booster. When you call the pharmacy, they may say that's 10 days to 2 weeks before it's available. So to work on that, the state is going to be offering expanded community vaccination sites, and we'll be creating more of these as we go forward. I'm happy to say, though, that as of Friday of this week, we'll have 2 large facilities, one in Colorado Springs at the Chapel Hills Mall, and a second at the Douglas County Fairgrounds that will be able to do up to 1,000 doses per day starting this weekend. And we also have the Pueblo Mall that will be offering them as well. So we're excited about that. We know that we have other sites that we'll be announcing in the near future so that it will be easy for persons who are pursuing and interested in getting their booster dose to get it done. I think it's really important to do the boosters at this time. It not only helps reduce transmission and prevent hospitalizations, but it allows people to avoid getting sick or having to quarantine or to isolate, and therefore be able to participate in all the holiday events that are coming. With that, we're going to transition to Nicole, who will speak a bit about safety during this holiday season.
Thank you, Dr. Franz. So we're going to shift gears for a moment and provide tips for having a safe and healthy holiday gatherings. One of the best parts of the holiday season is eating meals with friends and family. These tips can help you avoid foodborne illness at holiday gatherings. You want to thaw your turkey safely in the refrigerator or in a sink of cold water, changing the water every 30 minutes, rather than thawing a turkey on the countertop. Please keep raw meats and poultry separated from other foods like fruits and vegetables to prevent cross-contamination of germs found on meats and poultry to foods that may not be cooked prior to eating. Cook meat, poultry, and seafood thoroughly. You can use a food thermometer to measure the internal temperature when cooking. For turkey, you want to shoot for 165 degrees Fahrenheit, and along with other poultry items. For cooked hams, you want to reach 145 degrees Fahrenheit. And for ground meat products, you want to reach 160 degrees Fahrenheit to make sure that meat is safe to eat. You want to cook stuffing thoroughly. It's safest to cook stuffing in a casserole dish rather than cooking it inside of the turkey. Next slide. A good rule of thumb is to keep hot foods hot and cold foods cold. Keeping hot foods held above 140 degrees Fahrenheit and cold foods below 40 degrees Fahrenheit will ensure that those foods aren't potentially having germs that are growing to levels that can make you sick if you consume them. A good rule of thumb to follow is the 2-hour rule. Discard any perishable foods that have been at room temperature for more than 2 hours. You want to avoid eating raw doughs and batters. Raw eggs and flour can contain bacteria like Salmonella and E. coli. So making sure those items are cooked before eating is best. Always practice good hand washing when preparing foods, and CDC recommends not washing your turkey before cooking. Doing so can cause the juices from the turkey to contaminate countertops, utensils, the sink, and other food items nearby. There are also things you can do to minimize the risk of COVID-19 at gatherings this holiday season. For instance, you can plan a gathering where everyone over the age of 5 has been vaccinated. Stay home if you're displaying symptoms of COVID-19, if you're positive for COVID-19, or have had recent close contact with someone who has COVID-19. You can consider hosting smaller, shorter, or outdoor gatherings. Outdoor events are generally safer than indoor events. Smaller groups are generally safer than gathering in larger groups, and shorter gatherings are generally safer than longer gatherings. Keep a list of guests and their contact information so they can be notified quickly in the event of a COVID-19 exposure. If you're gathering indoors, you can improve ventilation by opening windows and doors if it's safe to do so, or by running your heat, air conditioning, or an air purifier. The CDPHE website has more holiday safety information. The link is on the slide here. I'm going to turn it back over to Brian. I think this concludes our presentation to open it up for questions.
Thank you to all of our presenters. We're going to go ahead and open it up to the media Q&A portion of this morning's avail. A couple of notes. If you have a question that you can't get answered here or that wasn't covered in today's press conference, feel free to email us at media_info@state.co.us and we'll get back to you as soon as we can. And for this Q&A section, we'll use the raise hand function and we'll call on reporters excuse me, in the order those hands were raised. Let's start with first questions first. If we have time towards the end here, we can circle back for some follow-ups or second questions. And please do state your name and outlet before asking your question. Let's go ahead and start with John Daly.
Hi, thanks for taking our questions. John Daly, Colorado Public Radio. I guess there's a question for both Scott and Eric. Yesterday, Robin Wittenstein from Denver Health said that the system is on the brink of collapse, that's how serious things are. I'd like to get your take on those comments and what does that mean? What should residents in Colorado understand about the state of the hospital system as it is currently?
I'll give that one a start, and then Dr. France, maybe you want to add anything to that. As we've been talking about for several weeks now, there has been increasing stress on our healthcare system. And we have been working with our partners at the Colorado Hospital Association, pulling together that combined hospital transfer center to ensure that every bed in the state is available and in use, and also continuing to encourage the public to make good choices about getting their booster shots, about getting tested when they're sick. This is a time for all of us to pull together and ensure that we all do what we can to protect our hospital system.
Yeah, I'd just say, John, that it seems as if as different counties have different infection rates, we see that hospitalizations soon follow. And so to the north in the Larimer County, over the last number of weeks, things have been very stressful. Patients were being moved from the north down to Denver and further south. Now things are stressful in Denver. They may become more stressful in the Springs and down in Pueblo, where case rates have been high of late. So Scott and I are in constant contact with the hospital systems to understand where they are with this work. And we appreciate their partnership, their ability to flex and create a ceiling that isn't hard. That is to say that they can expand and care for patients as needed. There is a risk that soft ceiling becomes a hard ceiling at some point. And so we'll be working hard to prevent that. And we can all do our part by following the recommendations that would minimize spread and risk for hospitalization here in Colorado.
All right, let's go to Jessica Seaman.
Hey, why do y'all think that the cases among the 5 to 11 age group are dropping off? Because we haven't seen a big change in their behavior with school, and they're just now getting vaccinated. So I'm curious why y'all think those cases might be dropping.
I'm happy to take a first stab, and then maybe we'll see if Alexis and Nicole might add. The spread within schools is always complex in the sense that there's clearly the spread between children. It's lower, of course, for COVID than for flu or other viral illnesses. And I think, the other aspect of it is behaviors, masking and what's happening after school and what parents are doing. So I assume that the risks that a 5 to 11-year-old have, while the school is an important piece of it, it's not all of it. And as all of us in Colorado hear and learn more about these rising cases, families are taking the appropriate steps to minimize the chance that their children will become ill. They may be reducing contact with other families. They might be testing more. I think all of that plays a part. And I do think that we're doing a good job with our vaccinations of the 5 to 11-year-olds. I think, again, we're a leader in the country in terms of our rates to date. And I feel confident that that's also contributing to controlled rates.
All right, let's go to Chris Vanderveen.
With 9 News. Is there, and I apologize if this was covered on the front end. I missed the front end of this, so if I'm going over territory that's already been covered, I apologize. But it looks as if we're going to have a bit of a drop-off today in hospitalizations. Not large, but a bit of a drop-off. It also looks as if Northern Colorado, as Dr. Francis referenced, is starting to ease a little bit. Wyoming has certainly eased quite a bit over the last couple of weeks. Is there any indication that our rise is easing as we are now a day before Thanksgiving?
If there's an indication, it's only that in the last couple of weeks, the rates in Colorado seem to have plateaued. If you look across our experience from June to now, you'll see these periods where we plateau and even dip. I think at the end of September and early October, we dipped down a bit only to rise again. And given that we have Thanksgiving this week, with lots of people gathering, I wouldn't be surprised if the rates, after being plateaued for a couple of weeks, start to rise again in another 10 days. So this isn't the time to assume that things are getting better. We have to be vigilant and do all the work that we're doing to reduce case spread, as well as protect our hospitals. Ask me in a month, though, and we'll have a better sense of things.
Let's go to John Ingold.
Hey, everyone. John Ingold from The Sun. Thank you for taking our questions. I have one on monoclonal antibodies. At the GERC meeting a couple of weeks ago, Amanda Hettinger presented some information on the rate of providers actually reporting to the federal government when they were administering monoclonal antibodies. And it was low, it was like 50, 60%. And that caused the feds to end up thinking that we weren't using as many doses as we were being given. And then she said caused them, at least at one point, to slash our weekly allocation. I'm wondering if that issue has been cleared up, or is that something that's still a problem?
Scott, I think there's a twofold answer to that question. First, not all of our providers are reporting on a weekly basis, and so that percentage does stay. Right now we're still at about 60% of our providers who are reporting each week. That being said, we have not seen any drop-off in the amount of monoclonal antibodies that are currently allocated to our state. We are receiving about 4,000 doses a week right now. And we have been in constant contact with our federal partners, with the White House, to ensure that we can get increased supply when we reach that point.
All right, let's go to Jack Hickey.
Hey there, Jack Hickey, KKTV 11 News. Thanks again for your time, everyone. My question is just, when people hear that cases are plateauing across the state, people get very excited. They want to get back out into the community. We've had several plateaus in the past, like you've mentioned, only to see cases rise again. What is your message to the public about sticking to these safety protocols until we can really stamp this virus out and get a hold on it?
Well, I think the first message is if you want to be excited to get out more, then please go get your booster shot. And if you haven't been vaccinated, then of course we strongly recommend that you get your vaccine done. With the third booster or your second J&J booster, we know within weeks your risk of being a case or being hospitalized drops by over 90%. In some ways, this is the height of our protection, right? And so if you're preparing for holidays where you know you want to go to a family event or a special show or a sporting event, if you can get your booster shot 2 weeks before that, you should feel good about your level of protection in the weeks following that. So that would be my strong recommendation. And just pay attention to our hospitals, and that should help you think that, boy, I still need to be careful, because whether I'm in injured in a car accident or have a fall at home and need the hospital or have chest pain, those beds are going to be tight. And in large part, it's because of our COVID cases that are in the hospital. So doing everything we can to stay healthy, to not become a COVID case that ends up in the hospital is our primary individual responsibility right now.
Right, Jessica Seaman.
Hey, with cases going up among kids, I heard that there's also been a rise of MIS-C cases. Do y'all have any numbers on how many of those cases we've seen within the last month?
I can speak to that if you'd like. So our MIS-C reporting process actually has a little bit of a lag because the providers report to us. We review the charts, then we submit them to CDC for final determination. So I don't think that we have any MIS-C numbers that would reflect recent cases. We could get back to you about reported cases, but we don't have a recent enough confirmed case count that would address that question.
Right. Thank you, everyone, for joining us for this morning's media availability. If you have any additional questions that we were not able to answer at this Q&A, please email us at media_info@state.co.us. Thanks again for joining us this morning. Hope you have a really great holiday weekend.